Liberia, Mama Liberia. Must all rise. Let's stand together to fight Corona.
Good morning, everyone, and welcome back to today's edition of Health Talk. So male circumcision, which is practiced for social, cultural, or medical reasons, is one of the oldest and most common surgical procedures performed globally. It is estimated that 1 in 3 male worldwide are circumcised. Now, here at home, some male foreskin may slip off sometimes after birth, or some in childhood, and some in their teen years, either in hospitals or in dieters' rooms, and for some in their adulthood. Now, there are mainly two ways in which male circumcisions take place. One is through male medical circumcisions, and the other one is part of the traditional practice of rite of passage into manhood. The interest in male circumcisions over the years have been mainly portrayed. One is the role that circumcision plays in HIV prevention, and the other one is the unfortunate severe complications and, in some instances, death associated with the traditional circumcision. So our topic for today is male circumcision. And our guests include a registered nurse, a student at the Mother Patin College of Health Sciences studying Master in Nursing and Midwifery Education, a full-time lecturer at the Smart Institute of Management and Technology. He is also serving in the capacity of Special Assistant to the college president. We also have another registered nurse, a BSN graduate of the Mother Patin College of Health Sciences and a certified child and adolescent mental health clinician with a lot of clinical experience. To be part of the discussions, the numbers to call is 0770 107 107 0886 107 107. So you can simply call these numbers to share your view with us or ask our guest panelists all of the questions you want to know about circumcision. If you're outside Liberia and you want to be part of the discussion, you can also call our WhatsApp number +231 880 571 223. That's our WhatsApp number, so you can also call that number if you're outside Liberia and be part of the show. Please don't forget to keep sending all of your messages on our Facebook page, and don't forget to subscribe to our YouTube channel, Mama Lumen Health Talk platform. So sit back, relax, and listen to the educated health talk coming to you just after a short break. I am Mama Lumen. This is Health Talk.
We are project. Liberia, Mama Liberia. Must all rise. Let's stand together to fight Corona.
Welcome back. If you just listen to me today, we are discussing male circumcision. The Mama Lumen Health Talk platform is a 1-hour program that discusses a wide range of health-related issues. It brings you face-to-face with health professionals and provides you with causes, signs and symptoms, complications, and preventions of diseases and illnesses affecting us in our respective community. Alright, let's talk about circumcision today. On today's edition of Health Talk, we are going to discuss circumcision. It is a great pleasure for me to welcome our studio guest for this important discussions today. He is none other but Mr. Chokon E. King, a registered nurse and a full-time lecturer at the Smart Institute of Management and Technology, a master's degree student at the Mother Patin College of Health Sciences, reading nursing and midwifery education. Mr. King, welcome to Health Talk.
Thank you very much.
And next to him is no one else but our own brother and a hard-working registered nurse, recent corporate. He is also a satisfied child and adolescent mental health clinician and have a lot of experience in the clinical setting or in the hospital setting when it comes to health issues. Welcome to Health and Recent Corporate.
Oh, my pleasure.
So today we are discussing male circumcision. First of all, let us start with Mr. King. Mr. King, we're looking at male circumcision today. Can you just take us through some of the historical ways or the pattern in which this circumcision is done?
Yeah, male circumcision, as we know it, is a surgical procedure of removing the full skin of the cleansed penis. And before going into the historical analysis, firstly, we want to go into, because we from the medical surgical background, we want to tell you about the anatomy and that of the physiology of the penis. The male penis has a structure, and it has the part that is attached to the abdomen or the abdominal wall, which we call the root. And then progressing forward, we have the shaft, and the shaft has a lot of nerves and blood vessels running through it. And in the center of it, it lines the urethra, which is responsible to excrete urine and sperm to the outside world. And at the tip of the end of it, we have the glans, and that is the most sensitive part of the penis. And that glans, upon childbirth, that glans penis is covered by a full skin, which we also call the prepuce. So it covers the entire penis, and we'll further go into the other discussion. Back then, it started, Herodotus made some record about it in ancient Egypt, that circumcision was going on, and then there are a lot of relevance given to it because people who are circumcised, there are a lot of benefits that outweighs the risks associated. So we also have some historical perspective when it comes to the Bible, which it is mentioned in Genesis chapter 17 verse 10, which we talk about is a commandment that all male child be circumcised. So it is a commandment, and it's also dated back to the Jewish tradition. There's a ceremony on the 8th day in the Jewish tradition. They do a circumcision, we call it the ceremony of bris. And it is a ceremony that is actually believed by the Jewish people. So it is something that is very, very common in the historical times.
Okay, thank you so much. Thank you so much. At least we got a history of circumcision. We know that it is not just done today, but they've been doing it almost 1,500 years ago. So, recent couple, in my introduction, I talked about two cardinal ways of circumcision. That is the medical male circumcisions and then the traditional practice. Can you just take us through the traditional practice of circumcision?
Well, my brothers just gave us the history of circumcision. We can say that that's something that have been practiced way younger. And back then, before, we never had something they call hospital where you will go to, and a hospital where they get plenty equipment they can use. So back then, we have our old people that used to really do this thing, and up to present, now all the circumcision that is taking place in the hospital, we still carrying it from our various houses. Our old people do that. Well, some of them, they may use Caesar that I have seen. Some of them use their own Caesar. And some of them even use razor blade and a lot of things they use to remove the foreskin from the penis. Yeah.
Okay, and these practices are still going on?
Sure.
Oh, okay.
These practices going on.
Okay, so Mr. King, there is a saying, or there is so many reading, so many research, so many things have proven that circumcision reduces the chances of HIV and AIDS. So I just want you to give us what is the science behind circumcision reducing the chances of HIV and AIDS.
All right, thank you very much. You see the cleansed penis, which we have the foreskin covering. If that foreskin is retained, there is a lot of chance of bacterium or other organism being embedded under there. And the more they are there is an increased risk that you could transmit infections to other people, including HIV and AIDS, urinary tract infection, sexual transmitted diseases and infections. They are all transmitted through that medium because you have the foreskin being covering the glans penis, and there is a possibility that those organisms could be beneath that area, and it will also transmit the disease to other people. So it is very important that we see how best to get as many people circumcised.
Okay, so let us come back to recent. We were talking about the traditional mentors. Recent, I just want you to take us through some medical indications of circumcisions.
Yes, so to Alan, let me start with what my brother started with by the circumcision when you are not circumcised, but increasing your chances of developing or having HIV. We all know HIV and other sexual transmitted diseases, you can get it when you having sex. So let's say for instance you are not circumcised and you having sex. I can give example to people to say, let's say your fingers, you have a little sore on your finger, and the doctor took the plaster and cover it, and that finger is covered, and you went on and start doing something with it. When you go bathe, when you remove the plaster remain intact, and you will just bathe and cover around and wipe around it. But what will happen when you remove that plaster and look under it, you will see that there will still be that under that particular plaster, because at the time you're bathing, you never remove the plaster. So like the penny, it having that foreskin covering the gland penny. So if that gland penny that foreskin is not removed for the gland penny to be exposed, we all know when you go through sexual intercourse, and that person, if that person is infected with HIV, definitely after intercourse, you may not be, when you are cleaning, you're not going to remove the gland penny and clean it and put it back down. No, it will remain as it is, and you will then clean over. Now what happened? So whatever mucus or any other fluid that going on there, it will not be removed. So the chance is very high for coming down with HIV or other sexual transmitted diseases.
Okay. All right. Thank you so much, Adis, for clarifying that aspect of medical indication. So, Mr. King, we come back to you. Are there any complications when we're talking about circumcisions?
Yeah, there are a lot of complications associated with circumcision, and one of the complications could be the issue of infection, because, like my brother rightly said, if this procedure is not done under a good medical atmosphere, like in the traditional you were talking about, you could be having a chance of coming down with an infection. That is, the blood can be infected, something we call septicemia. That is blood infection. So it could be that as a result of a contaminated instrument. Another complication could be the person, you need a proper medical history from the family member before conducting such surgery. Because some family in their line, they have the sex-linked problem, which we call hemophilia. It's a sex-linked disorder in which the blood does not clot properly. So if this person is a patient who family line has the hemophilia, that person may still carry on some severe bleeding. And we all know that the more you bleed, the more you are at risk for anemia and other respiratory problems. So there are complications. So that's the reason why we always advise that it is done under medical supervision. Because mind you, we have two different ways in which wounds are acquired. We have the intentional wound and that of the unintentional wound. And the wound we create in a circumcision case is an intentional wound. Because intentional wounds are wounds that we perform under surgical supervision. And the wound is properly dressed under sterile condition. So the risk for infection is lower and other complications are lower.
All right, thank you so much. Thank you so much for these complications. So, recently, I'll come back to you. Are there any traditional complications?
Well, like he was adding up the traditionally, we say traditionally we just fire facing it, but let's say for common English, the one you do to your horse, the circumcision that we can do to the horse and we can carry to the hospital. If you go to the hospital, they got all the good equipment that they can just call it in less than 10 minutes. Circumcision is not something that is a difficult procedure. You can perform it in less than 15-30 minutes as long as that person don't have other pre-existing condition. But if you are performing it outside, number one, the person who performing it, do they have the reference instrument? Do they have the forceps? Do they have good scissor to use. So definitely, if I'm performing circumcision, I don't have scissor. What will I use? I will use razor blade. I will use knife. I will use whatever sharp instrument that I have. So the point is that instrument I'm using, is it really? He says sterile. Sterile, to be sterile, for people out there, sterile means, is it clean? Is it really clean? Is it pure? No. But hospital, they get where they can keep that equipment that can be very clean. But to the horse, you don't have it there. So there's chance for what? That particular person to be infected with whatever instrument that you be using. What is more, we don't want to say that person may even develop tetanus from there. That's number one. And again, we're talking about the bleeding. That's the main complication in circumcision. That's the bleeding. You know, he was talking about the structure of the penis, right? You have all of the veins, you have the urethra, you have the shaft that have the veins that only carry on blood. So, circumcision, you have to cut, and when you cut in the gland, the pupils, which is the foreskin, you may cut a vein. So, what is the cut of vein to your house? And you don't even have nothing to be able to conceal that particular bleeding. So what will happen to that child? That child was not bleeding in your hand. You have no idea what to do to stop it.
Sure.
So having circumcision to your horse, these are the complications that attach. Bleeding will come, and you have no idea how to stop it. But to the hospital, we get everything there that we can use to be able to control that particular bleeding.
Okay.
And
Okay,
before you come in, there's another complication that we didn't mention, which has to do with the issue of the anesthetic agent that we use. We got anesthetic agent are those agents that we use in order to reduce the level of pain sensation when we are carrying on the procedure. Sometimes other people have a reaction to the anesthetic agent used. So sometimes that could be another complication experienced.
Okay, thank you so much. Thank you so much for taking us through the complication, both medical complications and that of traditional complications. So we have so many viewers on our Facebook page. We have Abdullah Nyang, he is watching. We have Dixon Coffee, he is watching. He said, thank you, Momoa, and your studio guest. And we also, Adonai is a very educated, thanks a lot to the host and the studio guests. You guys are doing great. So let us come back to you, Mr. King. Please keep your message coming in. We need more of your message. Keep your questions coming in. Share your experience with us. Now come back to you, Mr. King. We're talking about male circumcisions, right? So can you just take us through how this whole circumcision process is done and at what age it should be done?
All right. Normally, right after birth, the procedure can be done in a young male child, and it can be done at any age. Let's not get it twisted. It can be done at any age, but it's preferable. The sooner is the better. Okay. So we do it at a young age, and as I said, in the Jewish tradition, they do it on the 8th day after birth. That's that tradition, and as we know, the earlier is the better, because the more you get older and have not carried on the procedure, sometimes the fear of pain. Sometimes when you think about the pain, you don't even want to do it at an older age yet. So while the child is still young or after birth, few days, you can do the procedure. The procedure is a minor surgery, because surgery are classified based on minor, whether it's minor or major. And also, it is an elective surgery. You can choose at any point in time to go and do it. It's not something that is urgent or emergency. And healing process is usually a few days up to at most 10 days.
10 days.
Yeah, so it's not that too long. So at any point in time, you can want to do it. But it is preferable you do it at an early age, especially when the child is just born.
Okay. So
and you ask how the procedure is performed. So they have different instruments used, usually in our labyrinth setting, because we are speaking from labyrinth context.
Sure.
Usually we have the clamp, and then you have the scalpel. The scalpel is a surgical blade, and those instruments are all sterilized. So you want to pull the foreskin a little bit forward, and then ensure that you go in with your clamp and clear the pupils from around the glans penis, because you're going to be very careful now before you cut the head of the penis. That would be another dangerous thing. So when you have ensured that it is clear, and then you can now retract the skin, ensure that it's also clear. Then you want to use an antiseptic solution to ensure that it is free of microorganisms. And then after you have cleaned it thoroughly, the next thing is you want to instill your anesthetic agent. You could use a lidocaine or xylocaine, or you also want to use a cream. They have the anesthetic cream. All of those things, you are using them in order to reduce the pain sensation. Okay, you want to anesthetize the patient. And then the next thing you want to do is, after you are ensured that the cleansed penis is completely click-free, that you are very sure that it won't be cut, then you can now pull the foreskin forward, clamp it, and then you can now do your cutting. After you cut, sometimes you may hit a bleeder. That is a blood vessel. And if you hit a bleeder, there's a need that you stitch it as soon as possible, because you don't want bleeding all over the place. So if that is not the issue of hitting a bleeder, you want to now do a little stitching to where you have, or where you have cut. Okay, and then for a child who is very young, you want to use Vaseline. You don't want the wound get stuck to the diaper. So sometimes you use a little Vaseline around it regularly until it heals in 7 to 10 days.
And when there is too much bleeding, you have to go back to the hospital.
Yes.
There is circumcision.
Yes. If the child is taken home and you notice that there is bleeding, you have to go as soon as possible back to the hospital so that we can see where the bleeder is coming from and see how best we can locate it.
All right, thank you so much. Thank you for that clarifications. If you're listening to us and you want to be part of the discussions, the numbers to call is 0770 107 107 0886 107 107. So you can call and ask our studio guests all of your questions you want to know about male circumcision, male medical circumcision, or traditional male circumcisions. Or you can easily call and share your view with us. What was your experience when you went through circumcision? Have you been circumcised before? Are you still passing over the tradition to your male children? So you can also call us and share your experience with all your perspective, especially when it comes to circumcision. So the phone line is open 0770 107 107 0886 107 107. Call and ask all of your questions you want to know about circumcision. So let's come back to you, Mr. Cowboy. Mr. Cowboy, today we're discussing circumcisions. Are there any other benefit of male medical circumcision than just reducing the risk of HIV and AIDS?
Okay, so circumcision become a little bit. People try to debate about it as to whether we should get circumcised or not. But I was trying to drop back similar to the traditional way, like they say, from where it started. Like the Christian, it is mandatory, it's a confidence for them that they should do it. God told them that they should start it from the very early age, like from the 8th day of the childbirth. You should circumcise him. And then for even other religion, other traditional religion or things, if you are on the day of your circumcision, become a very good day for them. In fact, they view it as the day you become man. Even the Islam, for them, they believe that before you circumcise some of them, you have to restart the entire Quran. That day you are enshrined into the Islamic religion as a male. So like other traditional background, on your day of your circumcision, that day is a big day for you because you're becoming part of them in that particular culture. And we know in Liberia, man, once you are circumcised, the thing is, today you're becoming a man. So other people, they say they won't want to do circumcision because that particular foreskin or that people that is around the gland penis, it is sensational, which means it can give you pleasure for sex for them. That's how they view it. So when you cut it off, they are saying that you're reducing the urge to feel when you are carrying on sexual relationship. But I can say,
but there are so many social media arguments. There are so many perspectives that those that are circumcised enjoy sex than those that are not circumcised.
I don't want to agree with them because even both the gland penis and the foreskin, they have they have sexual pleasure all right that you got from them. So even if you remove the foreskin, you still the gland penis still is sensational, that can give you a moon. But if the foreskin is there too, you also enjoy it. But for the fact that the foreskin it prone you to developing some infection, why not you clear it up from that? Because the gland penny will still give you some, pleasure when you stimulate you for sexual activities.
And most people say, most women say they feel more safer with men that is circumcised to have sex with than male that are not circumcised.
So whatever the Tuesday, and again, we talk about the age, right? We talk about the age range. Like for the Christian, we know that you should do it early by the age of what they say, not even 1 year, but it should be 8 days. That is the rightful way. But then some people have an argument. They will say, okay, when you cut the penny at a very early age, it becomes small.
Really?
Yeah. So
you cut the penis, or you cut the
if you do circumcision, let's just say, that bro can say when you cut now, that one the very English, right? When you cut a person not at a small age, you can get the knot will be small. Let's just put it that way. But we want to disagree with you. The penny, what caused the penny to become big? It's not because they cut it when you're small. It's not because you become big man and the penny have enlarged that you call it now it remain big. No. The size of the penny depends on a lot of things. It's not just because your penny was cut at a very old age or you reach man before they can call it. No. There are reasons that, because if a child is born, the gene responsible, your parent, your dad, you think he had a big penny. No, that's the first thing. Plus your own gene that you coming with, responsible for it. And some people have, you may be born and then you have a low testosterone level. So if you have a low testosterone level, you're not going to get big pennies at your breath. You see? So, we have hormones in us that regulate our body system. One of the main hormones is the pituitary gland that control all of the other hormones, the LH and the FH. They are responsible. So at your breath, if your environment factor or your gene it has low testosterone level in it, you're going to get a small penny. Or maybe you are dwarf. People are short. You are dwarf, you got that kind of short background. Your penny not going to be big. So penny, the enlargement does not until your circumcision be done at birth or at an elder age. But it depends on your anatomy.
Okay, thank
so,
you.
And more than that, the issue about enlarging the penis or whether it is small in relation to sexual activity, sometimes sexual activity doesn't actually depend on whether you have a large penis or a small penis. It all depends on how well you have the female satisfied. That's the major issue.
Okay, that's true. All depends how the female is satisfied. That's a major issue. So if you get your ball is in your court, it depends how you play the ball. That's how you will score your goal. So if you're listening to the conversations, the numbers to call and be part of this conversation is 0770-107-107, 0886-107-107. You can call and be part of the program. Please do not call on my personal number because I'm not going to answer. Call on our studio number. Good morning, your name and where are you calling from?
Good morning.
Good morning, your name and where are you calling from?
My name is Jason Coffee. I'm calling from Kingston.
Yeah, Jason Coffee, welcome to Health Talk.
Thank you very much. I want to appreciate you and appreciate my colleagues in field. They are doing well. I had experience when I was in my country and how they are discussing your circumcision rural era is so discouraging. When I saw one of the next era when it was circumcision. And the circumcision is your house, several procedure and other things. But it just very sexually. So this is really enlightening those that are listening to see at least when I carry out circumcision, it mentioned in a way in which we are using it. Even if we're professional, when you don't know it, you don't engage yourself in it.
Of course.
You have to know it, you got to do it the best way. Like it should be your sterile procedure, because any other thing will enter your blood vessel, and that child will be crippled from it. And nowadays, if you listen to people are doing circumcision and they are putting out the children technique, and it's very bad. So we should be professional now, and thank you all so much for it.
Thank you so much. Thank you so much for adding to your voice to the many voices in studio here. Thank you so much. And that's true. Circumcision is a very sensitive surgical procedure. So when you're doing it, you have to be very careful because an inch mistake you make, you're going to damage somebody's sexual organ. And you know what I mean when you damage, you made a person lost in life because with all their money, all their education, and they can satisfy, like our guest said, you can satisfy your partner. It's just going to be a waste of time. So when you're listening to us, the numbers to call is 077-107-107-0886. 107. Please do not call my personal number. Call our studio number so that you can be part of the program. If you're watching the Facebook Live, the number is right on our Facebook stream there. So you can check there and call the studio number. Please do not call on my personal number. The numbers to call is 077-107-107. Good morning, your name and where you calling from?
Good morning, madam. I'm Evan Kamara, calling from the Zambia.
Yeah, Abraham Kamara, welcome to Health Talk.
Yeah, thank you very much. I just wanted to ask a question.
Okay, go ahead.
If let's say you got a small penis and you got big and then you needed to at least to enlarge it, is that any means that it can be enlarged?
Okay, thank you so much for that question. Our studio guest will address it. All right, thank you so much. So you listen to his question, Mr. King. He said, should in case you have a small penis, is there any means that you can make it large?
Yeah, well, there are a lot of different sources of things on the market these days that people are buying in order to carry on enlargement of the penis. But our concern have been tuned towards the side effects associated, because in the long run, if you kind of use any of these medications or any of these practices to enlarge the penis, remember there are side effects, okay? And sometimes the side effects can be very grave. So it's better that you work with what you have.
Yeah, so you know, when you these days we get it the big cell phone and you tap on it, you come or pop will come and all of that telling you should use help, you should use other medication. But you know, the thing is just a structure on your body. Can you change your eye to become small or big? Can you change your head from big to small? Could you change any part of your body? Even though yes, they are doing some how they call it, surgery, cosmetic surgery on their body part these days, but again, look at the cosmetic surgery that is done, how guaranteed it is. There is nothing guaranteed than what God gave you. So if you want to enlarge your penny, you got good work to do. But I think for my advice is just try to see what you can have and be satisfied with what you have.
Okay, thank you so much. So I hope the caller that call you listening to our studio guests try to be satisfied with what you have. Because even when you take this medication, it's just like when you scratches a rubber band, right? And then after that few minutes of having your sexual pleasure, and then when you already relax now, you start feeling bad because your penny will look, I don't want to describe it anyway. So if you're listening to us, the number to call is 077-107-107-0886-107-107. So you can call and be part of the discussion. Call and ask our studio guests all of the questions you want to know about male circumcision. There will be traditional male circumcision also. Call and share your experience. So we're coming back to you again, Mr. King. Are there any other benefit other than are there any other medical male circumcision's benefit other than the reduction of HIV transmission?
Yeah, it also helps in order to avoid something we call phimosis, because when the foreskin remains over the glans penis for a period of time, sometimes you get connected to the glans penis.
Good morning, your name and where you calling from? Oh, we lost that caller. I'll continue.
Yeah, sometimes you get stuck to the glans penis in your condition called phimosis, and which still needs circumcision to correct it. And also, we know most time males have the issue of STDs, and one of the STDs is the syphilis. And if you happen to have syphilis, you start to have pores and other things coming from the urethra. If you have the the Glen's penis, covering it, it may complicate the problem leading to redness of the penis head, which is also bad. So there are more benefits when you remove the Glen's penis as compared to the ricks.
Okay, thank you. So,
And then just to add up, you know, when I can just say simply, it's all about hygiene. You know, doing circumcision, it makes you clean. You know, if you are not circumcised, there are a lot of risks that you are prone to. All of the STIs you talk about, you are prone to it. It is possible that you may come down with any one of them, gonorrhea, STD, syphilis, the HIV. And what is more, there are much complications he talk about. He talk about the phimosis, it could be phimosis, it could be parasymosis, wherein the Glen penny refuse, it come down and it can go up. Or either it go up, it can come down, then you need one circumcision to remove it. And what is more, you can create a heat infection on that particular foreskin because that heat, right? Water go there, or more fluid go there, and it remains there. It's not coming from there. What happens? As long as they stay there, bacteria growth there, and you can what do you call it? Develop heat infection right there, and that whole penny here will get inflamed. They get red, you see, and you are prone to a lot of this disorder. So, to make yourself clean, cut the penny, and you are good to go.
Yeah, indeed, to live a safe, happier, and very good and social life, we have to be circumcised. And I also learned that it's safe for penis cancer.
Cancer, sure.
Yeah, it's safe for
Yeah.
penis cancers. So all of this, you know, other than just HIV, it's safe for so many things. So it's always good to be on the safe side. If you're listening to us, you still got a chance to call and be part of the program. 770-107-107, Call and ask a lot of your questions you want to know about male circumcision. Good morning, your name and where are you calling from?
Yeah, my name is Yata S. Mataboy. I'm calling from Cinco.
Yeah, Mr. Masako, welcome to Health Talk.
Yeah, thank you very much. I highly appreciate it for the topic. And I say thank you very much. I think for still getting still there. I need to elaborate on so many things that people don't know that now. Because of circumcision, you see as a topic, people do circumcision without the so by several procedures. But if I wait people who do it, we did that area or even get material to sterilize my area, there is no way. So what should I do?
All right, thank you so much. Our studio guest will address your concern.
Okay.
Yeah, you listening to the question?
Yeah, I think the first thing Mr. Masoka needs to understand is once there's a need to carry on a circumcision procedure, you should identify that it should be done firstly at a health center or a clinic or somewhere that there is a medical expertise. Because we don't want people to
have experience
in that area. Because we don't want just anybody performing the procedure outside of the facility. Okay? So if you want to do a medical procedure or circumcision in Bogongiri or how to reach area.
Good morning, your name and where are you calling from?
Hello,
Good morning, your name and where are you calling from?
it is there from West Point.
Yeah, it is. Well, welcome to Health Talk. You're live. Welcome to Health Talk. Now continue.
Yeah, so if you find yourself, how to reach area, it is advisable. You see how best you get to some of the closest area where the procedure will be done on a sterile condition in order to avoid all of the other complications, especially the risks of infection.
Yeah, and to add on to that caller, you see Bogongiri has a health center that...
Good morning, your name and where are you calling from?
I tell you, it's there from West Point.
Yeah, Elizabeth, we're discussing male circumcision. Welcome to Health Talk.
I only waiting for you to...
Oh.
That's a wrong number, Elizabeth. You call your studio number.
Okay, so like you said, Bogongiri, or let's just first aid, being at a rural circumcised. That's why he thinks he's been driving up.
Okay.
At a rural setting, I know we do have health professionals all around. And we just want to encourage you to go to a health professional when they are at the clinic. And we all know that we all are trained and that is clean, that will not infect you. So we are not saying that you should move from Boko Junior and come over to do circumcision. No, but we know that Boko Junior have a health clinic, they have a health center that you can go to, and they will do that procedure for you. Instead of calling one Oma or one Papi to do it, we don't want to discredit them, of course, but we want to teach you that while these things, they may leave you prone to other complications that we don't want you to go to experience.
Okay, Mr. King, let me ask this question. How do we make circumcision safer in the way forward in our country?
Well, one of the ways in which we can make it more safer is to encourage.
Good morning, your name and where you calling from?
Yeah, my name is Eva Sapa, calling from Brazil.
Yeah, Eva Sapa, welcome to Health Talk.
Yeah, thank you. I want to find out something. If you circumcise your child, when the flesh start coming back, you can re-circumcise.
Okay, keep listening to Health Talk. I will just discuss that.
Okay.
All right, thank you.
Okay, so thank you for that question. It is important. You see, that's why we are encouraging that we take our children to the hospital or health facility or clinic where they get professional. You know, the gland penis is something that can regrow. So if that person who performed the procedure, who did a circumcision, who circumcised your child, he, instead of cutting the entire gland penis and all the surrounding tissue that should be removed, and he leave anyone there that is intact, definitely it's going to grow. So the best you can do, early as possible, take that person to the health facility and they're going to correct that particular error. Remember, that gland, that penny, it is your child future. I can put it that way. So it's not something for you to play with. So carry it to the best place, let it do the best thing for you.
And sometimes there can be outgrowth of the skin. You know, everybody don't have the same skin texture. So now there are complications to wound. And some of the complications include what we call hypertrophic scar. So sometimes if your wound is about to heal, sometimes you have this scar coming back on it. So that's what Corey just said. It is necessary that whenever you see some of these things or complications occurring, the health facility is always your friend.
So in general, now, how can we correct this mistake? How can we make circumcision in general safer and going forward?
We see how best to encourage every one of us, both the traditional birth attendants, both those who work in the rural setting, that we see how best we encourage everyone that needs circumcision to see how best they take their children to the facility. Because the facility going to ensure that the procedure is done on a safe or sterile condition. And with that, we make circumcision more safer for our society.
Thank you so much. So, Racing, how do parents or patients make decisions around circumcisions for your male child? How can you guide it in that discussion?
Okay, you see, circumcision is very, very sensitive topic. You know, it's something sensitive. You know, that's why when you say circumcision, I was thinking which one, male or female. And when you say male, I say, okay, I'll be there. Female, that is now easy topic to discuss. It have cultural thing attached to it, even though we can say they talk about it more. So you see, who make the decision? You know, circumcision, I decide based on the parents' family, their religion, their culture, you know, what they are attached to. So let's say I am a Muslim, or let's say I am a Christian. So you make your decision from there. But like I said, we want to encourage you to make the decision as early as possible. Don't wait for the child to become of age before you say, I'm taking that person. It requires pain. It's pain. You can't be sitting there and somebody cutting you, looking there. You know you yourself how you will feel. So if the child is small, they don't want to feel much pain. And you know the person who started it a God, right? For us, a Christian. For the Christian side, we know God. He said when the child is, when the woman gave birth, according to the Bible, the person is unclean for a good 7 days. So when the 7th day passed, the 8th day, he said you must call it. So if God can say call it as early as 8th day, so who are you to make a decision to say let him get big because you want it to become big? And again, the Islam will say from Abraham too, he did it. Muhammad, the Prophet Muhammad said this circumcision. So we too, we want to do that in that manner. But if you will say you want to leave it there because you can enjoy sex more, it make you man more, or it can make you to get good penny, well, that's something that we want to decide on. But we encourage you that you do it as early as possible. Then the child is a baby, you're not going to feel it as more as when they are men or when they reach a stage where you want to do it because of your personal reason.
And more to that, at the early age, the child may not have the issue of preconceived stress, but as compared to when you are of age. Because when you are of age now, and then somebody come to you and tell you, we're about to circumcise you, and the fear is built up, and then you have more stress associated. So I concur with our reason that we see our best to do it as early as possible.
Okay, and sometimes so that panic associated with the fear, also everything like you're looking at that scissors, looking at that blade, looking at everything like the data is coming to what you say, it's always good to do it as early as possible. So time is fast spent. Studio time is our greatest enemy when they come to lectures, activities, or have discussions. So I don't know. Moving forward, we have few more minutes to draw the conclusions of this whole discussions. Moving forward, I just want to know, as a male, we know that it was passed through the Quran, the Bible. There are so many scientific proof that circumcised. So how do you feel as a male being circumcised and looking at you passing that traditional over to your male children? How do you feel?
When we were kids, when you have a colleague among you guys that is not circumcised, we know it's something that we always put more on that person. You will see us, we always lashing that person. Hey, you move from here, man, you're not circumcised, you are not man. It's common. So, number one is denigrating when you are not circumcised. You even feel ashamed to go among your colleague. That is the one thing. And you feel proud because it make you man. And you like, oh yes, I'm man now. And if your penny is cut. So, I feel fine myself. So for me, circumcision, I think my kid's going to be circumcised.
You are influencing over there, right?
I'm not impressing.
Because these days, you see a lot of advocacies on social media, on the media, like people talking about circumcision being oh my God. Anyway, let us not go there. Mr. King, can we get your party comment and your advice to the public on male medical circumcisions and that of traditional circumcisions?
Yeah. So it is.
Oh, this will be our last caller. Good morning, your name and where you got it from. You're so lucky.
Yeah, I'm calling for the second time. I need Eva support. Calling for Pusequato.
Yeah, Eva, welcome to Health Talk.
Yeah, but something else small.
What's his age?
Okay. How old is him?
In 1 year old.
So he can
Can he urinate freely?
Yeah, but small. Like small.
Okay.
He can help him.
I think you need to go back to the hospital and inform the doctor so they will do a field check. Okay, we just lost that call. If you're listening to us, you can go back to the hospital and inform the doctor. Maybe there were a procedure done that caused that problem, but they can also work on that issue. But my best advice to you is go to the hospital. Don't go to everyone nurses or traditional nurses. The first thing you have to do is even go back to the hospitals and explain the problem to the doctor. They will do so many checkup and tests on that child, and they will know what is the cause, and they will, since that 1 year, they will bring up a solution as soon as possible. Yeah, Doc, can we hear your parting comment in that of your closing statement? Is okay?
Yeah, so traditional practices in dealing with circumcision, we want to see how best we can rule out that. Whenever there's a need for circumcision, we see how best we can take our children to the hospital setting because it is safe and it gives every one of us a brighter future. So thank you very much.
Thank you. So, Reason, can we get your parting comment and that of your closing statement on male circumcision?
Yeah, so now to the public, I want to say thank you all those that are carrying on circumcision. We appreciate that a lot, and we want to say circumcision make you man. So don't play with it. Please try to do it as early as possible. Take your children to the hospital or a trained health practitioner who will do it with a clinical know-how to free you from any complication.
Okay, thank you so much. I'm so sorry to those that are calling. We are not accepting call now because we are almost out of time. So keep your messages coming in. Keep all of your messages coming in and keep following our Facebook page. If you have so many questions to ask, but because of time factors, you can just go on Facebook and check Memorial Women Health Talk platform, click and follow, and then drop all of your comments in the comment section. We're going to discuss each and every one of you guys' comments one by one. Thank you so much for joining us today. I want to take this time to say thank you to our studio guests for educating us on this sensitive and important topic on male medical circumcisions and that of traditional circumcision. I want to say thank you to all of our callers. Thank you to all of our social media followers. For those that were following, thank you for your comment. Keep them coming in. I want to say thank you to Hot Heaven family. Thank you to Honorable DJ Blue for allotting us time in studio to always discuss issues that are affecting us in our respective community, because we need to focus on prevention aspect. With prevention, we live a better and a healthy life. Thank you so much, and stay tuned. Join us next week, same studio, same time, on another topic that we'll be bringing to you live on the Memorial Health Talk platform. Thank you so much.